Welcome, everybody, to our Powerful People interview today. I want to introduce you to Dr. María de León, who's on with me today. Hi, Maria.
Hi, everybody. Thank you for having me on your channel today.
We are so excited to have you. This is really, really special. So thanks for joining us. We already have several people on with us. So thanks everyone who's joined us so far. I'm going to just give everybody a little background about you in case they haven't read in advance, and then we'll get started.
Wonderful. Thank you.
Okay. So Dr. De León is a fellowship-trained movement disorder specialist, as well as an avid research advocate. She got her BA from my hometown in Philadelphia at University of Pennsylvania, and she and I both graduated from the same medical school.
How wonderful is that?
So unusual. Hahnemann University, so Hahnemann Medical School in Philadelphia. So we have that in common, which is really exciting.
Wonderful.
Yes, she got her did her fellowship at Baylor College of Medicine, and she is coming to the Parkinson's community with a really unique perspective, as she also was diagnosed with young onset Parkinson's. So we'll be talking more about that as we go on. And over the last decade, she has spent most of her time championing women's issues and helping to lead the way in understanding the gender differences in neurologic diseases, and especially with Parkinson's, while also attempting to decrease the disparity in healthcare treatment among minorities. She's worked really closely with the Michael J. Fox Foundation and the Parkinson's Foundation, and has been instrumental in developing the Women's and Parkinson's Initiative. She wrote the very first book for women with Parkinson's, addressing the gender differences, which I have right here, the Parkinsons Diva, and I want to get to that too. And she's authored 2 other books and several other publications, including Living Beyond Parkinson's, which is in Spanish, and in perfect timing with Hispanic Heritage Month that we're celebrating. And let's see here, and then she also takes into account the cultural barriers that exist for the Hispanic population to become diagnosed, to be treated with Parkinson's, and the different obstacles that often can preclude them from being involved in clinical research. So she has developed an extensive collaboration with the Hispanic Outreach program through the Muhammad Ali Center of Parkinson's. She's also a blogger for Brain and Life magazine, Health Union, and her personal blogs, defeatparkinsons.com and parkinsonsdiva.org. So with all that being said, I know you have so much to offer our community, and we're really, really grateful to have you here today.
Well, thank you, Nina. God, hearing all that, I don't think I've accomplished all that, but thank you for for having me here. I'm really excited to share with everybody and to meet new people, make new connections, and especially being Heritage Month. And of course, like I was telling you earlier, I got my red and my green, so Mexican flagish. It's a little bit, to celebrate our culture. So
yes, of course. Well, we've had a really fun time celebrating so far this month, and been doing some different things in classes. And then this interview is something I know we've all really looked forward to. But I thought we might be able to just start on another note, and just maybe you could fill in our audience just about your initial diagnosis and how you processed this. I mean, you were already in this whole space to begin with, so that must have been.
Yeah, it was something definitely unexpected, which is kind of funny because Parkinson's has been my passion for years. That was the reason why I became a doctor. And so it's quite interesting that it came closer and closer as the years went by. As I was doing my fellowship, my grandmother was diagnosed with Parkinson's. And so I got to have a more personal insight into, what living with Parkinson's and dealing with that is. And actually, I was her caregiver the last 6 months of her life. So I know all about, having somebody bedbound depending on you and, being psychotic and those kind of things. And shortly after she passed away, I noticed that during my usual practice, which I had over 1,000 patients of Parkinson's, I had a busy practice, lots of Parkinson's in East Texas, unfortunately. And during my usual examinations, as you know, finger tap and open and close hands. And, I was starting to notice that I could not do it anymore either. I was telling patients, open and close. And I was looking at myself going like, I not having a good time doing this either. And I started noticing that I was just as off balance. I was the one having to use the bars in my office because I was veering all over and falling. And so I knew that something was going on, and I was having my handwriting got atrocious. Of course, I've never had a good handwriting and, doctor's handwriting, but it just seemed like it got worse and worse. And, nurses were having a hard time deciphering, and my nurse was having to write my prescriptions because I was having such difficulty. But the biggest problem was that a couple of years before I kind of noticed more of the movements, I noticed that I was having a lot of visual trouble. I was having trouble at night when I was on call and driving to the hospital. I could not gauge the distance between cars. And I almost got run over a few times by 18-wheeler because I could not really tell. And of course, started my, looking to see what was going on. And every time I went to ophthalmologist, neuro-ophthalmologist, everybody's like, your vision is perfect, yet I was running into things. I could not park in my parking spot anymore. I actually even hit a drug rep once in trying to park in my spot in my office because I could not tell, the left side of my vision was compromised. And so I knew there was something wrong, but, they kept telling my vision was perfect. And then very shortly after, I started having severe pain on my left side. That started in my foot, and that's where my rest tremors began in my foot. Of course, that confirmed, yes, I think I have Parkinson's, but being a specialist, being a trained, professional that, you don't have visual problems, you don't have pain and Parkinson's, right. Being, of course, at a young age, mid-30s, that was kind of like, okay, what else is going on? So I was obligated, like everybody else, obligated to go pursue all the different differentials, make sure I didn't have MS, make sure I didn't have, had every single test short of a brain biopsy, I always say. Or to diagnose. And 2 years into this, and I was a professional specialist, and I still right. could not get a diagnosis. And finally went to one of my colleagues, one of my mentors, who was one of my faculty members, and I said, there's something going on with me. People started telling me that maybe I was depressed, maybe I was sympathizing with my patients too much, maybe, because my grandmother had passed away. Maybe I needed to go see a psychiatrist because at this point I was just so irritable and depressed and sad, and, it was hard to work. And so I told her, I said, well, if you think I need a psychiatrist, I'll go see a psychiatrist, but I think there's something else going on. And I think I have Parkinson's, but again, with this vision and the pain. And of course, after all the tests and everything, and she gave me some Cinemed, which we all know is the true standard. And of course, as soon as I took some Cinemed, it's like, wow, my whole world was like, I feel normal. We still weren't sure about the vision and pain. So when I began taking the medications, lo and behold, I could park again normal. I could see normal. The pain subsided. And that's when I really began my advocacy work for this, because if I, as a specialist, had such trouble getting diagnosed, and still there was so much that we didn't understand and learn and know. And I was thinking about patients that I had that had these same symptoms and not really finding out what's going on, that I needed to be doing something. And the fact that, here I was, a young woman with a, toddler, and still, having a busy practice, just, starting a career. Certainly, this was not the type of Parkinson's that I treated in most of my patients. So I thought that we needed to really find out what was going on, and start researching and getting involved and making, changes in the science and the understanding of it.
Yeah. Well, sounds like quite a journey. And I mean, just for somebody in your position, I mean, I see that all the time, and I know you do too, but people are diagnosed so much later. They can have Parkinson's for so many years, and then finally they're diagnosed.
Right.
Because it presents in so many different ways, and especially if you're young too, that really seems so much more unusual. So.
Right. And unfortunately, we still have the criteria of the UK criteria, which is based on the motor symptoms, the rigidity, the tremors, the rest tremors, the balance, and the slowness. But I find, particularly in young people, I find that, those symptoms may not be full there for years after they've had, and we know that, sometimes you can have Parkinson's, preclinical Parkinson's and symptoms for 10 to 15 years before the actual diagnosis, because we're looking at the motor symptoms. But, looking back, I've had symptoms since I was in my 20s and doing my residency. So, because there were the non-motor symptoms that were going on. And so I think that that's where we need to really increase our understanding and being able to diagnose earlier. And I think partly because I was so in tune with my body, in tune with the patients and with the diagnosis, that I really was able to capture the very beginnings of my motor symptoms. And I really attribute some of that to the fact that I've done so well. I mean, perhaps, just because I've been on medications, perhaps, because young onset is different than regular Parkinson's. But I think that catching it early and treating it early makes a huge difference in your quality of life and the way the disease develops and progresses.
Yeah, well, that's good to hear. And I think, the sooner people can be diagnosed, the better. So raising awareness and your advocacy work for not just neurologists, but, runs the gamut. Family, I mean, any family doctor, internist. I mean, I was an internist, and I know, I knew probably this much about Parkinson's now compared to what I know now. So, and seeing my father and then now everything I know, but, I don't think not everybody is so as aware of all the symptoms and such a range of symptoms.
It's such a much more complex disease than we initially thought. Even for me as a specialist who trained in that, is beyond what we initially thought. And we're still learning new things every day. So I think that, maybe in the future, it may not even be neurologists who diagnose it, maybe other specialists, because it is such a complex and systemic disease.
Yeah. Well, I'm glad that you feel like you're managing.
For the most part, yes. I think, I'm doing really well. Of course, you had asked me earlier, how did I feel about my diagnosis? Well, of course, at that time, telling me that it was in my brain, but not like I thought, was a huge relief, thinking, okay, I'm not crazy. And two, I still know my neurology. I knew that I had something, neurological going on. But then, time settles in a little bit, and then you realize, oh my God, I have a progressive neurologic disease. And, thinking of all the patients that I've treated, and, my grandmother and everybody, of course, you feel like you want to have a little pity party for a little bit. And then I remember, sitting down with my husband at a dinner and just having a little pity party, crying, like, what am I going to do with the rest of my life? What is, am I going to be able to practice? Am I going to be there for my daughter? And, we're going to do the things that we wanted to do as a couple and things. So I still remember, we talked about just crying and crying. But my husband was very instrumental in helping me kind of embrace the disease, because initially, of course, I was very hesitant to let people know I had Parkinson's, not because I was ashamed of Parkinson's, but being a professional where you're the one in charge of people's lives and you're the one that have to take care, and they look up to you. If suddenly you say that, you're the one that's having issues, and is that, going to be a stigma? And so I battle with that, and not wanting to say anything. And even when I finally did say something, the board gave me a hard time initially, thinking that, I was not competent, capable of, treating patients. And so that was a learning experience that I was categorized initially and put in as a person that was, abusing drugs or alcohol, because thought that, that needed to be monitored like that. So we had to have a little, uphill battle because of that. So erasing that stigma that, just because you have a neurologic disease, just because you have Parkinson's disease does not mean that you're a competent, capable person that's still able to, to perform your duties. You may have some physical impediments, but that's something that, depending on who you are and where you are and what kind of activities you do, that may be a little bit more challenging than others. Being a doctor, one of the big things is being able to multitask, and that I found so difficult. And even now, multitasking, it is incredibly challenging because it takes so much dopamine. Never realized how much dopamine when I need to do something multiple, I really need to have higher doses to be able to function.
Oh, that's really interesting. Yeah, I mean, because I don't know if I would have thought of it like that, but that's very interesting to think of. And I know, like, a lot of people do struggle with that, that initial diagnosis, and then being in the workforce. I know a lot of people that are younger who are afraid to let their, companies know. And that really can interfere a lot. And I know so many people that are so capable and incredibly capable and can get a handle on their disease and move forward. So I think, just knowing what you're able to do and others are just so incredible.
Well, and tell me, sometimes I make it look easy sometimes, but trust me, it's not. And over the years, 15 years, I can tell it really is a challenge mentally because it requires so much activity when you're mentally engaged, and more than I ever realized. And so, that's something that I struggle with more than the physical. Because I think my physical, for the most part, I control, but mentally, it just requires so much more than, 5 years ago. So.
Right. Interesting. Well, let's just, maybe you could say a few words. Like, I know you've been a big advocate for research and for women. And then, like, since we are in the Hispanic Heritage Month, I just was hoping you could say a few words about your involvement with the Hispanic community and, some of the barriers that you are trying to help overcome with that.
Yeah, I've been incredibly lucky and honored to have met Claudia Martinez, who is the director of the Hispanic Outreach, and Muhammad Ali. And also, I got the opportunity through the Parkinson's Foundation to work with a program a couple of years ago with Harvard Initiative to design the first I guess, guidelines for NIH to what we needed to do to include diversity and inclusivity. And so that has been published in a book. And so that was said. So I've been very, very, very lucky to do that. One of the biggest things that I found is with all other cultures, not just Hispanics, but other minorities, is that sometimes, the things that work with one group don't work with another, because it is important to take not just the patient perspective and be patient-centered to be able to engage people in research, but and to also take it to their patients, but look at the culture. We can't just translate and do the same things we do for one group to do with another group, because the culture may be completely different. So in doing research and trying to get more people involved, we have to look not just at the language barriers, and the economic barriers and where they live. And most of the centers of excellence are in cities, and most people live, in the rural areas, so they can't come in, during the times they're normal for research, or don't have babysitters, or don't have, because usually for Hispanics particularly, there are a single unity where you have multiple generations in one household. And so they're responsible for more than one person. And so they can't really afford to spend all day or 2 days doing, some research. And so we really need to take that into account. So I'm happy to be collaborating now with the Parkinson's Foundation. They have the PD generation research that is now in Spanish as well. And the beauty of this is they can do it through telemedicine, and the doctor can evaluate them over, the telemedicine, and they can send the forms and the samples via mail. And so, and they even have it in Spanish. And when they get the results, they get a counselor to do the results in Spanish. So that is the most awesome thing that I've seen. That's the first study that I've seen where they actually include this. And I wish more research was involved where you can have the use of telemedicine and have that availability. And what we're trying to do is increase the participation, because, Hispanic participation in all minority is probably less than 1%, less than 5% for sure. So we're trying to increase it at least to 10%. And maybe once they start participating and they know that they can have a voice and they know that it is easy to do and simple to, they may then want to start participating in other research as well.
Yeah. Well, I think that's so just incredible that you're working on that. And I hope that there's a lot of progress. And I know we've been trying to make a little inroad ourselves. I mean, we've tried in Austin. It's challenging, to reach people. And now that we're with the global online program, and especially with this month, we're finally going to have a fully Spanish class, and we've created several bilingual exercise classes that we're going to be releasing this month. So we're excited about that, to try to get more people engaged, and we hope they get involved.
Yeah, the one thing that I love, I've been to 1,000 conferences, spoken lots of places and around the world, and still love my best time is when I get together with my Hispanic group in Phoenix, Arizona, because they truly are what a Hispanic Latin culture support group and conference group is. You don't have just the meetings where, you have the presentation, you have the information and, some food, but you also have engagement. We have people singing in the choir. We have people dancing, we have other activities so that the whole family can be engaged and the whole family can learn about the disease and what they can do as, caregivers, as children or grandchildren. And I think that that's what makes it a unique experience, and being able to bring that. And I think that you don't have to be Hispanic to be able to learn from those things. That I think that a patient does much better when you have a support group, when you have a village of people that is behind you and knows what to do. So that if you allow other people to come in and get the information, and learn what Parkinson is, what to do when something happens, who to call, what medicines. So they're at least knowledgeable. I think that would really go a long way, and also be able to more keenly say, hey, what about participation in this or that, and more keenly also able to participate, not just as patient, but also as, controls.
Yeah. No, that's amazing. And that you have that connection. And I'm sure you offer so much knowledge for them and support as well. So, and I think I agree with you. I think having the family involved and for anybody is so important, or having a support network can really make a huge difference for people.
Yeah, never quite. I mean, you understand that as a doctor at some level, but until you really live it, how difficult it is to be a caregiver 24/7 and feel alone, not have somebody to step in, give you a hand when you're tired yourself, or as a patient when you get down. And I was very lucky that when I was not able to drive, I had friends that could take my daughter to school or pick her up. But I really, again, was reminded the importance of a support group, of a care partner, when my husband took ill last year and almost died on me. I'm a pretty independent woman and I do a lot of things, but I still do have Parkinson's and I still have a lot of down days, and didn't realize how much of help behind the scenes he did that makes my life a lot easier, until he was not able to do it and I had to take care of everything. Then you realize how hard it is.
Yes.
So we've gained a new understanding for one another. I understand how much he really does for me. And he's like, how do you live with this? How do you live with this, disease for all these years, still keep going? So, we've had a good new appreciation of and respect for one another.
Okay. Well, I'm sorry he had so much trouble, and being a caregiver is so challenging. And I'm sure we have several that are on today too, and who have been through, it's hard, but to be that support person. And you have done you've worked on both ends, right? All ends, all sides.
All ends, yes.
So what about your book? Tell me about the book that you've written in Spanish. Maybe I think that would be a great thing to share.
Viviendo, allá, del Parkinson's, Living Beyond Parkinson's. And the cover of it actually was a collage made by the Muhammad Ali Foundation of various pictures of people with Parkinson's, Hispanic people with Parkinson's around the world. And this was presented at the Parkinson's Congress in Portland, Oregon, a few years ago.
Yeah.
And so wanted to have something that portrayed everybody. And I think mine is probably one at the end right there, like a little picture.
Oh, yeah.
so it's one of those. But, but I wanted to, because there's so little literature in Spanish in this country about Parkinson's. And I wanted to, at first I was going to just write my Parkinson's Diva in Spanish, which I did, but then I decided to just do a more general Parkinson's, because still what I find that the basic knowledge that Hispanics have versus the basic knowledge that other cultures have of Parkinson's is very different. The Hispanic community in this country and around the world seems to be a lot further behind, a lot more basic, what we would consider basic information of Parkinson's. What is Parkinson's? What are the symptoms? Who diagnoses? Who do you go to see? What kind of questions you ask? And those are the things that I try to answer in this book. Different, what are the treatments, medications, but also looking at the culture, again, making sure, because one of the things with Hispanics, we're very much, especially the older generation, we're very much taught to be respectful of certain professions or elders. So if a doctor says, do this, then you don't question it. You don't say, hey, well, can I try this something else? Or can I do research? Or can I, have surgery? So unless the physician mentions it, patients are not going to. And so we're trying to empower patients to be able to speak out and ask about things.
Yes. Yeah, I think that education and awareness is really, really key. And I guess one of our participants sent in a question here. Jay asked, what is the biggest barrier that the Latina communities encounter with getting diagnosed and treated? So we touched on that a little bit, but I mean, what would you say, like, why is it that maybe they're not diagnosed?
Well, partly is the language barrier.
Mm-hmm.
And the language barrier has two roles. One, being able to communicate what the symptoms are and having somebody that explains to them, or the patient explains to the doctor, but also that there's a certain camaraderie or confidence that comes with having somebody that is your own kind, your own culture. You feel more at ease, and you're more likely to tell them, discuss with them your symptoms, your issues. So if they're not of your same culture, at least try to understand your background. They're not going to make that initial report. So there may be, just not saying what's going on because they're not feeling comfortable. Most patients, Hispanics, go to clinics. They don't really seek specialists, and they usually go when they're having a problem. So they don't, unless they're having an acute problem, they're not going to make an appointment for 3 months down the road to go see a physician. So that's one of the things. Accessibility, the language. And also there's a stigma still within the Hispanic community, maybe some other communities, that a lot of the initial symptoms of Parkinson's are irritability, depression, anxiety, problems with memory, and all those seem to be some psychiatric undertones. And so there's a stigma of being able to say, hey, there's something, because they're going to be labeled that perhaps they are psychologically impaired. And so they don't really bring it up to others. So we need to erase that stigma that is mental health is as important, and it could be one of the initial symptoms of Parkinson's. So we cannot, just ignore it or say, oh, I'm just stressed, or, and unfortunately still there is that belief that Hispanic women are hysterical, or, they're just, exaggerating, they're nervous, they're anxious. And so that also precludes the diagnosis and delays it further.
Yeah. Well, I wish there was an easy answer or easy way to overcome all those barriers, because I know it's going to be it's a big process to try to overcome.
But I think that education and self-empowerment, and that's what we're trying to teach the Hispanic community and all of the people living with Parkinson's, self-empowerment, because it's easy for us doctors to say, you got this disease, go take this medicine, come back in a month, come back 3 months. We don't have to live. I mean, we worry for them and but it's not the same as, saying, here are the tools. It's going to be rough, living your life is going to change. So the patient, him or herself, has to have a change of heart, has to say, okay, this is my new life. This is my new lifestyle. If I'm going to get better and succeed and be able to manage and live with this, beyond just, surviving, but actually thriving, I have to do not just take the medicines the doctor tells me, but also what do I have to do? What do I have to, stay physically active, mentally active, get involved, with things and still continue to thrive. And that's the biggest challenge. And I think that if patients understand that, they can use their beliefs, their culture, find ways to, Hispanics are very artistic, they have a lot of art therapy. So one, like ceramics and painting and things, but all patients can benefit from that. Or, so boxing or what you do in your, and your, exercise. So that is important.
Yeah. Well, and tell me, so your book, if somebody wanted to buy your book, is it available on Amazon? Or
it's available on Amazon, as you can have the book print, also the e-Kindle, the e-reader is available. It's also in Barnes and Nobles, a lot of it, but you can get it on Amazon. Okay. And if you wanted an autographed copy from me, you can, let me know, and, and I will send that.
Okay, well, it sounds like I haven't seen that book yet, but it sounds like an excellent resource, something that would be really important. What's that? Oh, okay. When we are going to link that in the chat so people can find it easily.
Wonderful.
So I feel like we have so much to talk about, and we've also are getting questions, but I really want to also talk about your other book, if we can touch on that. And so the Parkinsons I Diva, I love this book. I mean, it really caught my eye, and that you have focused on the gender issues and women's issues with Parkinson's, and that, you know, some women have been treated, you know, equally to men, but a lot of the research has been biased towards men. So, and you have been able to point out a lot of some of the issues that might challenge.
Yeah. I never expected this book to, you know, it's started a whole movement around the world. The Parkinson's World Parkinson's Congress has got a young onset PD and women's issue, and working on some guidelines for physicians, for diagnosticians of what are important issues to look at and when dealing and treating with women. Because one thing that I discovered, again, because I was so young, of course, I was still having issues, hormone, menstrual cycles, and then, and I discovered that my Parkinson's medications would not only alter my menstrual cycle, but my menstrual cycle would worsen my symptoms. And so it really got me thinking about some of the other neurological diseases that we treat. They're hormonally related, like seizures and migraines particularly, and how we treat them. And I think that there is going to be a time where we really need to look at this treatment of this, just like we do catamenial headaches and seizures, you know, pre cycle and few days into the cycle when the hormone levels are changing, to really be able to target those symptoms. And so we're right now in the process of collecting data and information as to one, are there genetic differences? So part of that gene study that I was talking about, we're collecting data also about women's issues, women's hormones, and medications they're taking, and see if there's a difference. Because we know that at least there's some literature that says that women that have a hysterectomy with oophorectomy, with ovaries, total hysterectomy, before age of 40 are more likely to have Parkinson's. So that again tells me that there is some correlation, just like with Alzheimer's, that there's some correlation with hormones. So,
well, that's really interesting, and I like some of the points that you brought up. And I thought maybe you could share, first of all, this book, I mean, there's a lot of like great tidbits in this book. I think, you know, I'm going to just get a little closer for the women that might be out there. You might really be interested in this, the Parkinson's Diva, A Woman's Guide to Parkinson's Disease. And one of the chapters, you have a chapter on beauty tips. And you made a comment that if you look good, you feel good, you have more energy. And I thought, maybe, are there any tips that you could share today?
Yes, it's true. I mean, especially as my disease has progressed, and the apathy sets in because, you know, lack of dopamine, especially with this epidemic, and you feel like, well, you know, every day's the same. You know, you're not going out, you're not doing anything, nobody's going to come see you. So you start kind of not really paying attention to what you're doing. You're wearing the same stretchy pants, you know, the same, you know, pull-on shirt, you know, hair disheveled. And so, you know, and of course, thank God that I have to do these Zooms. So I have to go, you know, but every time, you know, you have to present yourself, even if you put a little bit of perfume or just, you know, sometimes a lipstick, it just kind of boosts your energy, makes you feel more feminine, makes you feel like you're a person and not just sitting there, you know, wearing, and so I always say, you know, when I was in medical school, I carried my lipstick everywhere. That was like my tool. If I had to give, you know, bad news, I would put on my lipstick and I was ready for the world. And it's kind of like that. And I wrote an article about putting, lipstick, showing PD who's boss with your lipstick, just carrying a simple little lipstick, and a lot of women have written to me say, I never wore lipstick and now I put a little bit and it just, makes me feel feminine, makes me feel, and you could do that with a scarf. I see you wearing a wonderful scarf.
Yes, I wore it in your honor.
Yeah. Oh, thank you. Yes, yeah. I love scarves. I'm always wearing scarves.
To add a little pizzazz. Yeah.
Yes, yes. And it just gives you that, that feeling because, especially for young women, but any women, but young women, you don't want to feel like you're losing that romance, that partnership. You don't want to be a patient. You don't want to be you want to still be sexy and attractive and have that relationship outside of Parkinson's.
Yeah.
We're still women with Parkinson's, so we still have to do the things we love. And I had to relearn, like I can't wear a lot of dresses because of the zippers. I can't wear certain jewelry anymore. That I have all these jewelry I can't wear because it's too small and things. So, but finding the right things. And just recently because I think it's about time I do another Parkinson's Diva. I was looking at all these things, how to do your nails, because the one thing that I noticed very early on with my vision and things, I was always doing my nails. I could not do my nails to save my life. It was like a 3-year-old was doing them. It was all over the place. I was like, what is going on? And trying to take the nail polish off. And I was like, how hard is that?
Yeah.
And so little things like that. So, coming up with different kinds of, sprays and things you can dip your nails in, or things you can, just let them sit there. Like I like the dry fast gel because you can't really mess it up. You put it once it's dry, so you can't really mess it up. So things like that, just to make it easier for it.
Yeah, well, you have some excellent tips in there. So I thought that was really good for anybody, but just your encouragement, I think that is probably good for everybody. If you just can put something on or just make yourself feel a little bit better, it just makes you feel better on the inside, or smiling, like what you also made some comments about smiling. If you smile, you make, it's hard for someone with Parkinson's sometimes, but even trying, it makes you feel better.
I know, it just releases some natural endorphins, and it's contagious. Smile is contagious. Of course, nowadays with the mask, you may not see it, but I'm always like smiling underneath the mask, thinking feel like a fool, always smiling when I see people. But I think that being able to connect and other people seeing your smile, they mimic the same, so you're enhancing those chemicals. So
yeah, I love that. So let's see. I had a couple other questions for you, and maybe we should get to some of the questions people have been sending in. But there was another chapter that caught my eye in your book that was your 4 keys to unlocking happiness in the midst of PD.
Yes.
So
always being
maybe
open
you could
to
talk
things.
about that. Yes.
Yeah. Being open, accepting. And the first thing was acceptance, because as I said earlier, I had a hard time, letting people know because I was afraid of the repercussions. I was afraid I would lose patients. But once, you open up, it release, it kind of release you and open a whole new world. But when I first decided I needed to, what would I tell my patients? And of course, one was like, being able to accept your disease. And here I was not accepting it. So I decided, I was going to go full blown. And I got me a t-shirt that said, I made Parkinson's look sexy. And that's the picture in that book, The Diva. And so, I was just going to go out there. So I went with that to the gym, to do physical therapy. So I was just going to own it. And, that really releases you. Because sometimes, we're holding on to I always like to look at the analogy of holding on to a balloon. And we're accepting and we're accepting. But this balloon is just like all over the place, flying in your face, going, and you're using up this hand all the time. You're not free. So if you just let it go, it's not going to be in your way. You're going to free up that hands to be able then to reach over to others and open your hands so others can reach in. Because sometimes, we're so angry, we're so upset at the diagnosis that we kind of keep to ourselves, and we don't let others, come in and help us and be a comfort to us, be a shoulder to cry on, because we're like this. Somebody talks about it, we're like, don't talk to me, don't look at me. But if we just release, then others can really hold our hands and support us. And also that releases to, do for others what you would like to have done. Like, if you need some love, some care, give it to others, and it always comes back, tenfold.
Right.
Times, like, and that makes you forget you have a disease. One, it makes you feel like a person, and you're helping and you're doing, and before you know it, you got, a whole circle of people. So accepting, being open, and not giving up, because sometimes, we struggle. And sometimes, I've been living with this for 15 years. And sometimes I tell you, it is an inch. It's a second by second. You're not sure if you're going to make it. You just want to get under the covers and hide and cry, your eyes out, and, don't talk to, but, this too shall pass. I always say, nothing lasts forever. And I always think of that lady, and I forget her name now, and I think I read in the book where she, she wanted to cross the English Channel, and she rode and she rode and she rode, and she got so tired, she just like, okay, I'm giving up. And she was just like, 5 minutes away from finishing her day, so you can't give up, because just because you can't see on the other side doesn't mean it's not there, that there's something better for you out there. So look, rest, cry if you have to, listen to your emotions, tend to them, but do not give in to them. Don't settle in always in this pity party, or, crying or being sad, reaching out and never giving up, looking, find that passion in your life that keeps you going.
Yes. Yeah. Well, that is such good advice. So I just want to suggest to everybody, I know this is a book directed to women, but you have a lot of great advice in here that I think can apply to anybody. So I think, I really appreciate your attitude and how you faced this. So let's see, we have several questions that came in from the audience. So let's see here. And are there any others, Garden? Yeah. Okay. Okay. So let's see. Grace wanted to know if you could say, how does young onset differ from regular Parkinson's?
Well, we're still trying to figure out all the details about it. Everybody's different. As you know, Parkinson seems to be more of a, an umbrella of a lot of different, etiologies. But in general, I think women versus men, and more, young women, because and older, is that you have more what we call negative symptoms. And I hate that negative symptoms, that what I talked about, the depression, the anxiety, the pain, the fatigue, that are more common at the beginning than, somebody that's older, may present more with tremors, or a man. So even though you have the akinetic Parkinson's, where you don't have as much tremors, you don't see those symptoms, which seem to be more pronounced, at least in my experience, in women. And I certainly had all that. I was fatigued, I was exhausted, having that irritability. And so sometimes you miss the forest for the trees, looking at all the symptoms, you think you got something else, but, it's part of the Parkinson syndrome. And as I said, the hormones, having a menstrual cycle, one, it makes your symptoms worse during the cycle,
right.
And then of course there's a childbearing age, and can you have children? And yes, people can have children, but during pregnancy, we found at least a couple of studies that pregnancy may be exacerbated, Parkinson's may be exacerbated during pregnancy. And then of course, we can't treat a lot of the Parkinson's medicines during pregnancy, because we're really not sure if they're safe. So there's a couple of registries, and we're trying to get a national registry, because we need to know this kind of information.
Yeah. Okay. Yeah, there's a lot to think of.
Yeah. But you can still have kids, and you can still have, but you have to think about my Parkinson's in 10 years and my kids at that age, because it not only are you aging, but your disease is, worsening. So.
Right. Yeah. Okay. So let's see. Okay. So Jay is asking, how can we get our doctors to understand the pain and the discomfort that are not traditional PD conditions?
Yeah, well, that's a really good question. First of all, Parkinson's does have pain. And although in the past we thought of pain being more common in the later stages, we now know that it's common in the earlier stages as well, the beginning, early presenting signs. And there's different types of pain. There's central pain, which is what I had the type of pain that I could not stand to be touched because I felt like they were pouring acid over my body. So that horrendous pain. Then you have pain like joint pain, and you have radicular pain like a nerve pain. So, if they're still having trouble there, you can go to the Parkinson's Foundation or Michael J. Fox Foundation, the Movement Disorder Organization, and you can get information about these types of, conditions that are present in Parkinson's. So perhaps bring it to your doctor so that our symptoms, Parkinson's. And what I find a lot is that a lot of the pain comes on when there's not enough, again, going back to not enough dopamine, not enough medication. So increasing the doses of the medication usually relieves a lot of that pain. And so, talking to the doctor about different options, different increase in medications, working with therapists, doing water therapy is an excellent thing to relieve, rigidity and some of the pain that comes with it.
Yeah. Okay. That's great. I did see another question here. I think Steve was asking what your opinion is why people get Parkinson's, what the cause is. That's a big question.
If I knew that, I would be a millionaire. No, we don't know. I think that, the theory right now that everybody's talking about, whether it's a disease that begins in the gut. And so that's the ongoing theory, but nobody really knows for sure, because as I said, I think there's different causes. We usually say there's about 5 to 10% of Parkinson's are genetic, but some of the preliminary data with this PG generation is showing that maybe up to 20-30% are genetic, and they're different genes. So it's not one root cause of it, unfortunately. Of course, we know there are risk factors. We know that people that have, of course, family history have a higher risk. People that have been exposed to a lot of environmental toxins, particularly, when they're talking about paraquat, but also in East Texas, we believe that a lot of it is because of the paper mills and the toxins in the well water. So those are increasing factors. Doesn't mean that if you were exposed to it, you will have Parkinson's automatically, but it's kind of a combination of genetic and environmental. So if you already have a predisposition, then you add something from the environment and it kind of triggers. And I really like to think, and this is just me, I mean, this is nothing that's proven, and I mentioned this, I really do think it's kind of like, how we have for certain diseases like lupus, like you have a list of things, and if you have 1, 2, 3, 4, then you probably have and I think that with Parkinson's, the more risk factors you have, I think that the incidence increases and the young onset, it becomes less. Like just looking at me, I have a lot of risk factors. So I'm like, well, that kind of, and so I just wondered if that, one of the risk factors is people that have migraines with aura. So, maybe it's another known risk factor now. So, I think we're just now starting to peel the layers of the onion to figure out what's really causing this.
Yeah. Well, hopefully the research will continue and we'll have more and more answers. It seems like it is progressing in the research.
Yes.
And I hope we're going to find out more and
Well, I think
in
that
a short time.
yeah, well, I think like I described it in the Parkinson's Diva. I think Parkinson's is like cancer. It's not just one type of cancer. And even when you pick, like cancer of the breast, it's not one breast cancer. It's like 5 different breast cancers, 6 different. And so I think picking out the differences and finding out which one you have, then we can customize and treat and maybe find cures for a particular type of Parkinson's, one at a time, and not like a whole Parkinson's as a whole.
Yes. Yeah. I think you're right. I think because you can see some people respond to certain medications and some don't even respond to dopamine or, so
right.
there's got to be some delineation somewhere.
Exactly.
Hopefully it will become clear over time.
I hope so.
Yeah. Well, it looks like we are like just about at our time, and we've had a bunch of people on today, and I think it's there's a whole big chat that's been going on, which I haven't been able to watch everything, but I hope everybody who's been watching has had their answers. Their questions answered.
If they have any other questions, they can shoot them to me, and I'll be glad to, to respond if they have specific questions. You can get my email, or, you can send them to me, and they can follow my blogs, defeatparkinsons.com and parkinsonsdiva.org. You may find some of the answers in there because I talk about different topics and Defeat Parkinson's specific, just in general.
Yeah. Okay. That's so great. We'll put that in the chat right now. And I just want to mention to everybody that you're going to be coming back for another interview with Gardenia and with Mariana pretty soon, and in Spanish.
Yes.
So we can reach a full Spanish audience. So we're really looking forward to that one also. And I will try to understand. We'll have English subtitles, maybe.
We'll have subtitles.
Yes, yeah, English subtitles. But I looked like we had over 30 people on with us today, so that was wonderful. We'll have this up for people to view afterwards. It'll be on our YouTube channel. So thank you so much. Thank you for everything you are doing for the Parkinson community. It's absolutely, invaluable. All your work is fantastic, and I know.
Thank you so much for having me, and thank you for all you do, and connecting us, and I look forward to working together more in the future. So thank you, and to Spanish interview next week.
yes, for sure. All right. Well, you have a great rest of your day, everybody. Everyone who came to be on with us. Thank you.
Thank you very much.
Until the next time.